Good afternoon. Sorry about that. Good afternoon, everyone. Thanks for joining us on the media briefing on this Wednesday. We're going to get started with a discussion about our upcoming COVID vaccine for children town hall. There are 2 town halls coming up where parents can get a lot of much needed information about vaccines for children and student mandates. And joining us to talk about this is Supervisor Luis Alejo, Monterey County 1st District, and Esmeralda Owen from the Monterey County Office of, oh my gosh, it's MCOE. So that's all we call you, is MCOE. Thanks very much for joining us today. And let me get started with a couple questions for you. I'm sure you have been hearing the same things we have been hearing. Parents have a lot of questions about vaccines for their children. How do you think this town hall is going to help them? And well, Supervisor Alejo, please start.
Yeah, first of all, I wanted to say that the Monterey County Board of Supervisors last month declared health misinformation a public health crisis, one of the first counties to do that nationally. So these town halls is really trying to get ahead of the game, get accurate information out to parents. I know this issue is top of mind for thousands throughout Monterey County, and it is certainly going to be a big endeavor, and we want to do it right. And there's a lot of moving pieces. I know the CDC I think their first meeting is on November 2nd. So we're going to get a lot more information as the weeks roll out. But this is an opportunity to be one of the first counties to hold this kind of town hall. Tomorrow, it will be in Spanish, and it's in partnership with Natividad, our health department, the city of Salinas with Mayor Craig and Councilmember Orlando Osornio and the Monterey County Office of Education. But this is one of those hot topics that I think a lot of parents are really thinking about. And I think we have to answer a lot of questions and get a lot of good information out there. The governor on October 1st declared California that it would be the first state to have a vaccination mandate for students, and really looking at 2 categories, 7th through 12th, and then kinder through 6th grade. After this, the CDC gives full approval to both. So this is something that's in line with what California already does for measles, mumps, rubella, among other diseases. So California has done this. This is not new, but it's certainly new when it comes just to COVID. So we do have 95% of students in California that are already back and in class instruction. And I think this is really about trying to keep our students safe and keep their families safe. And so I'm glad we're able to partner with our local health experts and our County Office of Education to get information out to parents as early as possible.
Thank you, Supervisor. And Esmeralda, I know that parents, I'm sure you've already gotten inquiries from parents about how are they going to manage as they look ahead to this mandate for students. What are you hearing from parents?
Well, what we hear the most actually is that they cannot wait for this mandate for children to be able to get vaccinated, 5 through 11, because they are scared and they want to protect their children. So this is what we hear the most. And of course, there's a few parents that have sent us messages that they do not agree with a future mandate because, again, this mandate is not approved, it's not in a law just yet, and it will happen any day now. But as of right now, we're just preparing for the parents and for the children and for the community to have this vaccine available for the children.
And are parents also asking about what would happen if their children didn't get vaccinated? Because I think there may be parents who are concerned. They haven't yet gotten enough information about the vaccine to make a decision, but yet they still want to know about going to school.
Yes, there's been a few questions and we are getting ready and prepared as well because we are not sure yet. Once the governor gives the mandate and this is right after the FDA approves this vaccine, then we're gonna know. Okay, do we proceed as we have in the last 18 months and have the students study remotely? Is there going to be maybe another method? So we're not sure, but we are just looking at the different scenarios and preparing for whichever one it is, or to adjust to a brand new one that is mandated by the state.
Well, as Supervisor Alejo said, the information is changing a lot. So what do you recommend parents do right now to get information?
Well, this town hall is going to be really important, especially in the Latino community. And tomorrow we are doing this in Spanish. So there's a lot of misinformation or misunderstandings. So it would be great to have the Latino community, especially, be aware that, what is happening now, where we're at, what our position is. And we're just waiting, for that mandate to happen. It will happen eventually. So we want the parents to know that as MCOE, we will be abiding by the law, and we have to follow the law. And we will help and provide all of the services, provide all of the vaccination sites to make it easy for all the parents to take their children. And for those who are not wanting to or willing to vaccinate their children, then we'll have the options, for homeschooling or remote learning. So there are options. We just do not want students to be interrupted in their learning. So we are going to do whatever we can and whatever it takes to make sure that happen.
Thank you for that. And I'm going to go ahead and share this just in case a press release went out about the town halls. And I'm just going to go ahead and share the slide so everybody can know what's happening. There are two of them. This coming Thursday is the town hall that is in Spanish from 6 to 7 o'clock, and next Thursday from 5:30 to 6:30. And we've got panelists, including elected officials, talking, and then our panel of experts from the health department, from Natividad, and of course the County Office of Education on both panels. So there will be plenty of experts there to help people with the questions that they have. They can answer a wide variety of questions. So if there are any questions for Esmeralda or Supervisor Alejo, this would be the time to go ahead and put questions in chat.
And Mia, I would just add that California students account for 12% of all the students in the United States alone. But right now, California schools account for less than 1% of school closures. So it shows that the mask mandates are working, these preventative measures. This vaccination will be that next level of effort to keep our schools open and to keep our students and their families safe.
Thank you. I do have a question for you. One's just come in. President Biden says the key in getting buy-in from the community depends a lot on trusted messengers relaying the messages. Do you have thoughts on that? I think we certainly have a panel of trusted messengers for our upcoming these upcoming town halls.
I think that was the intent here. When you do polling throughout this pandemic, the people who the community trusted more were the doctors, nurses, school officials, more than anybody, especially among the Latino community. They really look to the recommendations coming from their school leadership. So I think that's what we try to convey in this panel, to get some trusted messengers, experts in the field, pediatricians who are experts in childcare health. And I think that this is a good start, but this is only the beginning. We're going to have a lot more efforts to get the right information out by our trusted messengers to the community.
And in fact, the doctor from Natividad who is on this week's town hall is a pediatrician at the hospital. So if you have questions about children and vaccine, he is just the ideal person to ask your questions of. Any other questions for Esmeralda or Supervisor Alejo before we let them go and move on to our next topic? I'm seeing none. So thank you both very much for being able to drop in and help talk up and chat up our town halls. Thank you very much.
Yes, and see you guys tomorrow.
See you tomorrow.
Thank you, Maya.
All right. Our next participant, we've got Christy Michi, who is the Assistant Director of Public Health, who is joining us on the briefing today. She is going to take questions. So if anyone has any questions for her, this would be the time to put them in chat. Christy, I did have a question in advance that, golly, here it is. I'm seeing it, and I'll go ahead. This came in advance, so I'll go ahead and ask it of you. Um, well, how many people who were fully vaccinated against COVID-19 in Monterey County died due to COVID-19 related illnesses?
Good afternoon, everyone. It's been a while since I've joined you, so thank you for having me today. That's a question we get quite frequently, and I'm going to respond to it the same way we have in the past. Monterey County Health Department releases data when we believe that the data that we are producing have produced statistically reliable estimates and that don't personally identify anyone. And right now we're not releasing this information because it doesn't meet that criteria. However, the state of California and the CDC release this information on a national level, and that's publicly available. We don't have any reason to believe that our trends here locally are any different. So I would refer you to the CDPH and CDC data in the interim. What is interesting is that CDPH's website today had information that between September 19th and 25th, unvaccinated people with COVID-19 were 18 times more likely to die from COVID-19 than unvaccinated people with COVID-19. So it just really underscores the importance of everybody getting that vaccine as soon as you're eligible to get it and taking all those preventative measures. But vaccination is effective and safe, and it's our best tool right now to combat this pandemic.
Thank you. And another question for you. Has the County Health Department requested doses of vaccine for those ages 5 to 11? I think the window may have opened today.
So California is in the pre-booking stage for vaccine for individuals, the Pfizer vaccine for individuals 5 to 11 years old. So approved vaccine service providers around the state have started placing pre-booking orders. And as soon as the vaccine receives full approval through the process, which is, going through the FDA, then the CDC's Advisory Committee on Immunization Practices, and then the Western States Scientific Review Group. As soon as that passes, then providers will have those pre-bookings ready and vaccine doses will start to ship. So yes, there are vaccine service providers, including the Public Health Bureau, who are in the process of requesting their first doses of COVID-19 vaccine for the 5 to 11-year-olds. Very exciting time for us.
Thank you. Are there any other questions for Christy while we have her here? We've only just had just the one. I've just give it a minute. If anyone has any other questions, this could be the shortest public health media briefing that we've ever had.
Well, while people are thinking of other questions, I just want to put a plug in for flu vaccinations as well. It's really important this year to get your flu vaccine and your COVID vaccine. If you haven't got either of them, you can get them both at the same time. We have a partnership today with Salinas Valley Memorial Hospital and Palma High School, where we're offering flu vaccines. We're also going to be public health at Greenfield, the community center today. We'll be at CSUMB tomorrow, and Me Memorial Hospital, actually the Bread Box in Salinas on Saturday, and Me Memorial Hospital on Sunday. So there's lots of opportunities to get vaccinated.
I do have a clarification when the previous question about ordering vaccine for ages 5 to 11. So just if you could clarify, as the health department requested or not requested doses?
Absolutely, public health requested doses.
All right. Are people allowed to determine their own risk? Oh, this is a good question. Are people allowed to determine their own risk level for getting a booster shot?
Well, I'm going to rephrase that just a little bit. People are able to determine whether or not they meet the guidelines for getting a booster. So right now there are some there's some qualifications that people may have an underlying medical condition, or they may work in an occupation or industry where they have a high risk of exposure. People can self-certify that. There is no a form you have to fill out or any questionnaire. If it's been 6 months since your original dose and you feel you fall into one of those categories for which a booster is recommended, then please make an appointment for your booster dose.
Thank you for that. I do have a question has come in, but it's really for some of our hospital representatives who I do see some on the call, and I'm not sure if they are able to respond or not, but the question was about whether any of the hospitals have ordered doses for ages 5 to 11. And if any of the hospitals are interested in responding to that, now would be a good time. If not, I can I can send this question to you, and you can determine how best to respond. Any takers on this one? Nope. So I'm going to go ahead and refer that question over to our hospital representatives, and hopefully we can get some information back to you on that one. I've got some other questions for you, Christy. How many, Public Health has requested doses, how many doses? And Monterey County Public Health or State Health? I think understanding the difference between what the state may order and what local entities may order.
That's a good question. So because this is a new vaccine and a new process, we aren't able to get as many doses right off the bat as what we might like to get. The California Department of Public Health is rolling out vaccines for the 5 to 11-year-olds in waves. And so we're just starting the first wave, and these waves are going to come very quickly as opposed to the way vaccine was rolled out for adults or older adults. So this pre-booking is just starting for the first wave. And Monterey County as a whole only got 5,100 doses to divide up among all vaccine service providers in Monterey County. So not a lot. And among that, Public Health requested 600 doses. The remainder was split across the other vaccine service providers who requested doses. But the good news is that that's wave 1. Wave 2 is actually this week as well. So and then wave 3 is towards the end of the week. So the vaccine service providers are going to have 3 opportunities to order this week alone. So as our allocations come in, we'll get those orders. The orders will come in, and vaccine will be shipped just in those waves as soon as the authorization is approved. May, I think you're on mute.
I sure am. Thank you very much. I just wanted to confirm on the first wave of a vaccine that you just mentioned, the 5,100 dose total that you described, that is for all Monterey County providers, the health department being just one of them.
That's correct. We have over 76 vaccine service providers approved by the state of California who can receive COVID vaccine. Not all requested pediatric doses, but so there's not very many doses to spread apart initially, but we are assured that doses will continue to flow in.
Thank you for that. That's great information. Another question for you, back to flu. Is there a web page on the county website that lists all the flu vaccine clinics?
You know, that's a good question. I'm not sure there is one that lists all the available flu clinics. There is a flu vaccine finder that the CDC puts out, but I'll have to get back with you and check on that. I'm not sure that we have one posted specifically for flu.
Okay, and then I'll check back with you on that one as well and see if we can get that information out. Are there any other questions for Christy while we have her here on flu, on COVID? I'm not seeing any. Thank you very much, Christy, for filling in for Dr. Moreno while he's on vacation, and I'm sure you'll never let him take another vacation again. Thanks for joining us.
My pleasure.
And we'll now turn to from COVID over to emergencies, and we're very pleased to have Luna Mohammed from the Office of Emergency Services on to talk about the Great Shakeout drill, which is coming up this Thursday. Hi, Luna, how are you?
Great. How are you, Maya?
I'm good. So tell us a little bit about how people might be able to participate in the Great Shakeout. And of course, it always brings to mind Californians should always be prepared for an earthquake.
Absolutely. And with the pandemic and these past couple years as fires and public safety power shutoffs and winter storms, it's easy to forget or maybe just pretend it doesn't exist, that threat of an earthquake. But every year we do have the Great Shakeout. And this is our chance not just to remember that we are at risk of earthquakes, but that there are things we can do to protect ourselves and our loved ones in our homes from a major earthquake hitting us. So tomorrow, 10/21 at 10:21 a.m., we are trying to get as many people, not just in California, but nationwide and worldwide, to participate in the Great Shakeout, which is a earthquake drill. You're going to pretend like an earthquake is hitting at 10:21 a.m. and we're encouraging people to set an alarm or some other way to trigger that reminder that an earthquake's about to happen. You can start that drill then. The big thing you're trying to do is get away from anything that can hit you, drop, cover, and hold on. Get under a sturdy table if you can, and if you can't, just to cover your head. If you're in a wheelchair, to lock it. If you're driving, to slow down and pull over in an area where you can't fall and nothing can fall on you, like don't stop on a bridge or under a tree or power line. And not just to practice the actual drill, but if you can, especially if you're working from home or you're at school or the like, to practice the full-on drill. So not just drop, cover, and hold on, but where would I escape from? Where am I evacuating from? Is there a big bookshelf that's right in front of my main exit that's going to prevent me from safely leaving the house? And kind of doing that hazard hunt and seeing where in your home or your office or your work or school, the like, where the hazards exist when it relates to an earthquake. Practicing really helps reduce not just the fear that an earthquake can have, but also some of the bad behaviors that put people's lives in risk. So the majority of injuries and deaths from earthquakes in California's history have been things falling on people. So you run outside of your building instead of stop, drop, and cover, and you end up getting hit by a tree or the roofing shillings that come off of the roof during an earthquake, and injure yourself. So practicing and being prepared and knowing what to do is really, really important, and getting that drill at least this one time a year, but we always encourage you to do more. Now, not everyone can do it at 10:21 a.m. and some people might want to do it with their families or do multiple drills, and we definitely encourage that as well. But trying to get as many people to participate as possible. Maya, do you mind if I share my screen real quick?
Please do.
So I just want to share the webpage. So if you just go to shakeout.org, I'm showing you the California page right on shakeout.org. There's regions that you can click down from, which is right there. But you can get all the information you need, everything from videos to step-by-step guides if you have a business or you're trying to practice with the school or the like. And there are ways to do this safely. We have some COVID tips right here as well, but it's a really, really great resource. We had 7 million, a little over 7 million participants this last year, and we're trying to get as many as possible. The more people who practice, the better capable we are going to be as a community to respond to an earthquake. So if you have any questions, please do let me know.
And if anyone has questions for Luna, go ahead and put them in chat. Luna, I do want to ask you a question. This is not earthquake topic, but people think of emergencies and they're looking at the weather right now and they're seeing that it's starting to rain. Mm-hmm. And I'm wondering some of the other than, dropping, covering, and holding on, a lot of the preparations that people would do for the Great Shakeout, or a lot of the thinking that they would have about being prepared, can certainly apply to our winter weather preparedness as well, would you say?
Absolutely. And so there are some steps you can take to prepare in general for anything that comes our way. And that includes having a plan on what you would do if you have to stay home for a few days because a storm's coming. Or what would you have to do if you have to leave really quickly because flooding is damaging your home, or an earthquake's damaging your home, or a fire's damaging your home. Having a 3-day evac kit with a change of clothes and a flashlight and some food and water and maybe a book, something to get your mind off of things, having supplies at your house, including hygiene and 2 weeks of water and food and medical supplies, extra medical equipment, if you can, if you're able to get that. Those little things can help with any type of disaster you have. Another huge one is please do sign up for Alert Monterey County. You can do that at alertmontereycounty.org. That's the county's alert system. And that's how, if there's an earthquake or if there's a winter storm and there's evacuations or other emergency information, that is the quickest way that we can get a hold of people. So few steps that you can take will help you through these winter storms and through anything else that happens to come our way.
Thank you very much, Luna. And I think you've walked everyone through it pretty well. Nobody has any questions for you. And I will be checking in on what you'll be doing tomorrow at 10:21. We expect to see you under the county desk.
I am working remotely, but I will be under my table at home. And my whole family's participating too, including our dog. The way we're gonna participate with the dog is whoever's sitting next to him at the time will just have their hand on him to try to gently calm him. If he happens to be walking outside with my sister or someone else, they know to pick him up at that time so he doesn't try to run away, and just try to calm him so you don't end up chasing after a dog in the middle of an earthquake.
Well, and that's really good advice. There are a lot of us that have pets, and we may not be thinking what we should do with our pets in the event of an earthquake, other than wondering where they might be as they've run off because they felt it coming, right?
Sometimes you won't be right next to them, but if you are, it's good to keep them right next to you, and definitely don't open any doors after the earthquake without them either on a leash or being restrained, because they could freak out and end up running out and injuring themselves, because there can be glass on the floor or things falling even after the earthquake happens. So keep a hold of your pets whenever possible during an earthquake or any disaster, because they can panic also, and panic can lead to injuries. So
thank you very much, Luna. Good advice as usual. And I have no other questions, so that will wrap up our media briefing today. Thanks everyone for taking part. Our next briefing is next week. We'll see you then.